So the methylene blue is one of my mainstays on a regular basis overall, but especially when I have a big day, I'll be using more of that in the morning to help power me and give me extra energy, give more cellular support overall. Yeah.
Okay, so let's be clear with the methylene blue
Yeah.
piece. It sounds like you're having it every day. You're upping the dose on a day when you need to perform. Let's talk about the different dosages
Sure.
there.
Yeah. So methylene blue, the doses that I use are relatively low already. So what we developed is something called Just Blue, which is 16 milligrams of methylene blue at our company. And 16 is a very low dose overall. If you look at most of the studies out there, you're looking, methylene blue has been around a long, long time. A lot of the research is around a milligram per kilogram, which ends up being about 50 to 70 milligrams at a dose. But a lot of the additional data out there that's come out in the last several decades is more focused on neurocognitive optimization and mitochondrial optimization. And that's more 4, 8, 12, 16, maybe 25 milligrams of methylene blue. And so, and that the cool thing about methylene blue is it works, as I mentioned earlier, as a redox cycler. So what it means is that it can help with energy production, ATP production, but it can also work as a detoxifier as well. It can help as an antioxidant. And it also recycles NAD and FAD, which go back and help you make more energy. And so if you have mitochondrial dysfunction, especially in 94% of the US population has some element of mitochondrial dysfunction, then methylene blue can be potentially helpful as a result. Now, it's not the only thing you want to do, obviously, but it could be something that can be very helpful as a result of being able to compensate for mitochondrial dysfunction. And so mitochondria, I guess just a minute on that, like there are, when we learned about mitochondria in school, we learned that we had a cell that had a nucleus, it had cytoplasm, Golgi bodies, endoplasmic reticulum, and it had a mitochondria. So that's wrong, right? So some cells in our body have one, but most of our cells have many more than that, especially ones that are highly metabolic. Some fun trivia for you, Jesse. Do you know how the type of tissue or the cell in our body that has the most mitochondria per cell?
I know it because I've heard you say it on another show.
There you go. So
Ovaries and sperm.
yes. So your gonads. So your ovaries and sperm have the highest amount of mitochondria per cell. Then behind that is your brain, your liver, your heart, and your musculoskeletal tissue. So your musculoskeletal tissue have the muscles themselves have the most mitochondria per cell in reserve overall. And because if you need to be chased, or you're going to be chased, like you need to be able to get up and move and use those muscles as fast and as efficiently as possible. So the challenge is that if you have mitochondrial dysfunction, you have issues with fertility, you have brain fog, concentration issues, you have cardiac issues, liver detox issues, exercise-induced fatigue, all these things. And so working on mitochondrial function is so important. Knowing the reason why you have mitochondrial dysfunction is also very important. These are things like infections and toxins in our environment and medications and insulin resistance actually is the biggest reason why we have mitochondrial dysfunction overall. But in essence, what methylene blue can do is compensate for that mitochondrial issue and reboot, regenerate, and optimize it. And so for me, on a regular basis, I take a small amount, maybe about 4 milligrams, sometimes once a day, sometimes twice a day. But when I'm under more stress, I will take more, anywhere between 8 to 16 milligrams. And usually that's 8 to 16 milligrams in a full day, sometimes more than that, but not usually more than that. And what I find that does is it just raises the capacity for me to make energy more efficiently. And then it doesn't make you feel stimulated. It doesn't make you feel like you're on caffeine per se. And I don't drink caffeine in the morning, by the way, most of the time. And so for me, I don't need that stimulation as much. I tend to be already sort of more naturally sympathetic in the morning, if that's kind of how I operate. And so what I find what I need is just more of an elevation in my capacity, my brain capacity, my memory, my cognition. And so methylene blue could do a really good job of that. And so sometimes, though, on a bigger day, so I'll take the methylene blue, and that'll be helpful, somewhere between 8 to 16 milligrams, depending on the day. But I'll also add a quarter of a troche of something else called blue cannatine. And blue cannatine is a combination of methylene blue, very low dose, just 5 milligrams in a full troche, then nicotine, caffeine, and CBD. And so this is a great combination for me. I stopped drinking coffee, I think it was 2019, and I stopped drinking it because I started getting headaches, and I didn't realize that it was the coffee that was doing it. I thought I needed to drink more coffee, of course, and then I was like, oh, I just need more, and then I drink more coffee and get better and worse headaches, that kind of thing. And so I stopped drinking coffee, But I do like a little bit of caffeine, a small amount. So like in a full blue carnitine troche, which is the delivery device we use, it's about 50 milligrams of caffeine, which is a quarter cup of coffee equivalent. So I take 1/4 of a full troche, which is 1/4 50 milligrams, whatever that is. It's not a lot, and then that's with 1 milligram of nicotine in a full troche, just 0.25 in a quarter of a troche. And I find just that little bit there really does a fantastic job at just kind of turning my brain on just a little bit more, along with the higher amount of methylene blue that I'm taking for the day. And I use the higher methylene blue when I'm stressed, like when I'm traveling, or I feel like something like I'm getting sick. I'll use a higher dose of that as well, because it also at higher doses can have an antimicrobial effect as well. And so, but for me, it's usually on a bigger mentally cognitive day. It's going to be usually 8 milligrams of methylene blue pure, along with a quarter of the blue carnitine. And then I have my shake, as I mentioned. There was a little bit of creatine in it. Typically, that's about 3 to 5 milligrams, 3 to 5 grams of creatine. But on a bigger day or on a day that I didn't sleep as well, I might take as much as 15 or 20 grams of it. There are some studies that show recently that it can improve cognitive performance and kind of mitigate if you've had any sleep issues the night before. The green powders change over the years. It depends on the situation. Right now, when I'm using I think it's called super greens or something like that. It's something I get locally that I like. That's kind of the base of it. And then sometimes I'll add some cacao powder as well, some chocolate as well. I don't drink caffeine, as I said, but the coffee has some natural caffeine, a little bit in there. Excuse me, chocolate has a little bit of caffeine in it naturally, so I have a little bit of that as well. What else goes in there sometimes? Sometimes I'll add some turmeric powder, but I haven't been doing that recently. Those are the main ones that go in there, and then the protein powder itself as well.
So just to be clear, with the methylene blue, are you ever taking a day off, or are you always
Yeah,
having at least a little bit?
I take days off. I often take off on the weekends as well, depending on what I'm going to do. Because if I'm doing more endurance training, methylene blue is fantastic for endurance training because it can act just like oxygen in your cells. So your aerobic capacity, your capacity to make energy from your mitochondria, increases as a result of taking it. And so I have a lot of my endurance athletes that I work with that will take it, and they'll notice that their heart rate can stay up longer doing endurance work before they have to slow down. And I have a couple of patients that refuse to work out without it because it increases their heart rate for longer. I worked with a guy recently, about 3 months ago now. He ran something called the Leadville Race, which is an ultra marathon here in Colorado. It's 100 miles of running in the mountains of Colorado. It's legit. And so he was able to shave off, I think it was 3 hours of his time using methylene blue. I was giving him 32 milligrams of methylene blue every 4 hours, along with the blue carnitine as well. And so that's a lot of methylene blue, but he was also going for a very long distance. And so he shaved off a decent amount of time that way. So, but even your sort of regular endurance athlete kinds of people can benefit in that capacity. And so I use it that way. So sometimes on the weekends I'll take off, but if I'm doing more of like a longer endurance kind of thing, I'll use the methylene blue along with it to improve overall the endurance. And I can see the benefit overall with heart rate, with recovery as well.
For somebody brand new to methylene blue,
Yeah.
give a brief history when it came onto the scene and then its evolution to now.
So methylene blue has been around for a long, long time. It was synthesized as a textile dye back in the 1870s. So it's a synthetic ingredient. Yes, everybody, it's a synthetic ingredient. It doesn't mean that everything synthetic is bad for you. We live in a synthetic world, lighting, food, toxic environments. And so sometimes we need some synthetic things to help us. Okay. Just like everything that's natural for us, natural is not good for us. I've seen this on multiple occasions. People foraging for the wrong mushrooms, for example, ending up dying of liver failure. So be careful what you think is just natural is going to be good for you. So it's an important conversation to have because people in our space don't like to think about taking things that are synthetic per se. But methylene blue is designed as a synthetic dye, and then somehow they figured out that it treated malaria. And they were testing a class of dyes at the time that are called thiazine dyes, looking for ways to work on various types of microbes. And what they found is that you could give very, very high doses of methylene blue. It would kill pathogens, but at the same time, it would not have a detrimental effect on the human host itself. And this is why it got called at that time a magic bullet, because you could give these high doses of methylene blue, kill bugs, but not harm the human host. And In 1897, it became the first drug registered with our FDA. It was a new FDA at the time. And from about that time until the 1950s, it was really the primary or one of the primary antimicrobials available. And it was given at high doses. We're talking about a milligram per kilogram or higher for most infections. And we're using it those doses now for infections. Again, for equivalence, this is about 70 to 70 milligrams to 150 milligrams of methylene blue per dose to see the antimicrobial effects of methylene blue. Okay. And so in the 1950s, when penicillin and other things came around, methylene blue became less exciting to use, especially because it had a very blue side effect, making your urine very, very blue. And so people didn't like that, especially at higher doses. It can make other secretions very, very blue as well, like your poop or your tears and things like that. So, but this is at very, very high doses, like 2 milligrams per kilogram kind of thing, like 150 milligrams or higher of methylene blue. So in the 1950s, it became fish tank cleaner. So now that's why people know methylene blue as fish tank cleaner. And so if you go to a fish tank store and you want a fish tank cleaner, it's going to have methylene blue in it. The problem with that fish tank cleaner with the methylene blue in it is also contaminated with things like heavy metals, like your lead, mercury, cadmium, and arsenic. So you don't want to be getting your methylene blue from that source. That's a whole different ball of wax in the sense of even pharmaceutical grade methylene blue sources that you might find online can still be contaminated with heavy metals. So you have to be very, very careful at what you can find, but certainly you don't want to be drinking fish tank cleaner overall. And so methylene blue also became a drug that was used in psychotherapy, in psychiatry, because there are some qualities of it. It's called a monoamine oxidase inhibitor. And MAOI means that what that means is that it prevents the breakdown of norepinephrine, serotonin, and dopamine in the synapse. So it has mood boosting capacity itself. The first antipsychotic was derived from methylene blue, and methylene blue itself has been studied in depression, in bipolar, and seeing significant benefits from a mental health perspective. But it does increase those neurotransmitters, so it's something you have to be aware of overall. And so if you were in a lab in chemistry, any time in your life, you may have used methylene blue. Because methylene blue, what it does is it concentrates in the cells in the mitochondria. And so you can look under a microscope and see the mitochondria in your cell if you've given the cell methylene blue, because it's going to concentrate there. And so this is how we figured out that something was happening in the mitochondria when methylene blue is being administered. And methylene blue is actually still on the World Health Organization's list of essential medications. And it's for two different things. One is called methemoglobinemia, which is a condition where you cannot carry oxygen on your red blood cells. Methylene blue can help carry oxygen better by changing the redox status of iron. And then it also is on the list for cyanide poisoning. Cyanide poisoning is rare, thankfully, but cyanide destroys actually one of the complexes on the mitochondria that helps you make energy. And what methylene blue can do is it can help compensate for that in various really cool maneuvers to help you continue to allow yourself some energy production while the cyanide's around. So that's why it's an antidote for that. So we know now over the last several decades that it's a fantastic mitochondrial enhancer, and it does it in this redox way, which it helps it enhance energy production by ATP production, by compensating for any issues that you have on the ATP production cycle, which there can be many. And that also helps as a detoxifier because it can directly neutralize reactive oxygen species as well. At slightly higher doses, it actually increases your glutathione production. And then that also has an antioxidant impact significantly as well.
Given what you shared there about its impact on neurotransmitters in the brain, somebody on psych meds, is this totally contraindicated for them to use methylene blue, or do they just have to be careful with dosages?
So if you're on medication that is like a serotonin reuptake inhibitor, SSRIs, like if you're on them for depression, if you're on an SNRI or serotonin norepinephrine reuptake, these are kind of the newer class of antidepressants. And most antipsychotic drugs are also working on the dopamine, serotonin, norepinephrine system in various ways, depending on the drug. You have to be very careful taking methylene blue. Not so much that I think you have a risk of something called serotonin syndrome, which is the most rare complication if you have a lot of serotonin around. If you're not taking IV methylene blue, IV methylene blue with these drugs is unsafe and should not be used unless you have a significant clinical guidance. If you're on one of those drugs, an antipsychotic, antidepressant, you can use methylene blue, but I always recommend doing it with a healthcare practitioner, working very slowly with your dosing. The risk is not serotonin syndrome. It's never been reported with oral methylene blue causing this, but the risk is that you might not feel very good if you have too much serotonin around norepinephrine, dopamine that you're not used to. So this is also in patients that have Parkinson's, for example. There are actually some studies on methylene blue for Parkinson's patients and Alzheimer's and seeing improvements. But Parkinson's, usually you're on drugs that are increasing dopamine overall. And then as a result of that, there could be an interaction there because you're increasing dopamine with methylene blue. So if you're on medications in general, you always want to be careful when you're starting supplements and things like that. But certainly supplements that are dopaminergic, serotonergic, increased norepinephrine, these are things that you'd want to be more mindful and work with a practitioner closely if you're going to start methylene blue. On the other side of it, I have practitioners, psychiatrists that I work with that have been able to wean their patients off of the SSRIs of the world and use methylene blue instead, actually. And we know that depression is not a serotonin deficiency these days. That's been well described. So what I mean by that is that when you're taking an SSRI, you're not using it to work on a serotonin deficiency. You're using it to increase serotonin levels artificially to help you feel better. And that's not necessarily a bad thing if you need it, but it doesn't work immediately. And we know that in essence, that's not the root cause of why you're depressed. And so methylene blue can be helpful because it's working on all these neurotransmitters at the same time. But even better is actually working on the GABA system as well, because the GABA system is probably more involved in depression, anxiety than we give it credit for overall if you're GABA depleted overall.
Okay, coming back to your routine.
Yeah.
You take your methylene blue in the morning,
Yeah.
but it sounds like depending on the day, you'll take it later in the day as well.
Sometimes.
Certain days, depending on if you're performing or how you're feeling. What about MB and sleep in the combo? For somebody that takes it, say, after dinner, is that something you ever do? And how does that impact sleep?
So I usually don't recommend starting methylene blue in the evenings or later in the afternoon because some people, because of the way it's working, energy production, some of the monoamine oxidase aspect of things, oftentimes will feel more energized. They don't feel stimulated, but they feel more elevated. So some people find that if they take it too close to sleep, they'll have a hard time going to bed as a result of that. Some people, though, will actually take it before they go to bed and sleep better when they have methylene blue around. This is because sleep is obviously highly metabolic as well. It's not like we're sleeping and everything's stopped. Especially REM sleep is highly metabolic, and so you can find that some people will sleep better. For whatever reason, I've had a number of people tell me that they have much better bowel movements in the morning after having methylene blue when they go to bed at night. And so I've done it over the years, especially if I don't feel well. I'm thinking that working on methylene blue is, in general, when you feel worse, your body can take higher doses of things because you're not going to be as sensitive to them. Your body's utilizing them in other ways. So sometimes I've done that, but in general, I use methylene blue. Usually, if I'm going to take it twice a day, it's going to be at 8 o'clock in the morning or earlier, and it's going to be at maybe 1 or 2 o'clock in the afternoon, that kind of thing, as a secondary dose. Oftentimes, what I'll do in patients is that I'll give them maybe the blue canatine in the morning, like the one with nicotine, caffeine, and CBD, and then I'll have them take in like early afternoon, have them take the Just Blue, the pure methylene blue, as a way to kind of maintain some of that energy and some of that focus without having the stimulation overall. So, but yeah, in general, like on a regular basis, maybe 5 days a week, I'm taking about a quarter, once to twice a day, typically twice a day if I can get that second dose in there. And then on the days that I need to perform more, I'll take half of the Just Blue, so 8 milligrams, and a quarter of the blue canatine, and then I'll have my regular supplements in the morning as well, included in that. So
one of the cool things about taking MB is that you do feel it right away, or at least I did, and even on very low dose, like the Just Blue, having a quarter one of those, I'll feel it within like 10 minutes. The energy you have, the clarity, it's amazing. What I'm curious about is you talk about some of these higher doses. It sounds like those are reserved for infections and things like that, because I know the whole physiology changes when you go to those higher doses. But what does that feel like mentally? Because you feel it on such a low dose. Does it just keep getting more and more escalated, that energy and that calmness and focus in the brain? And what's the most you've ever taken, and what did that feel like?
the real thing here is that it depends on why you're taking it. In general, for mitochondrial optimization, you do not need high doses for 8, 12, 16 milligrams up to 25 milligrams. For more of an acute issue, I will give higher doses very quickly in people. So if they have acute trauma, acute low oxygen state, acute infection, I can give 1 milligram to 2 milligrams per kilogram, and people tolerate those doses very well. In general, the system is much more inflamed, much more stressed, and you don't have really any major issues that I've seen when it comes to like some of the things that you might see if you were using those doses at without being an acute issue. So, like for example, if you have a chronic issue, like if you have a chronic infection, for example, and you gave a very high dose, that may not feel very good. It may not feel very good right away because you might have detox symptoms, you might get headaches, you might feel like your brain is just really strange. And this is actually something that's been reported to me from people that have taken high doses without titrating their dose. So in general, if you have a chronic issue, the best thing to do is always titrate your dose. You don't want to start off at 50, 70, 100 milligrams of methylene blue. It's not a good idea in general because you may not feel very good if you do it. So what I always do is that if it's a chronic issue, I slowly titrate the dose and I titrate from 8 milligrams, increasing the dose every 3 to 5 hours, so 3 to 5 days, excuse me, until they start feeling better. And when they find the dose that's working for them, then we stay on that dose. Now, it depends on what the situation is, though. If it's more of a mitochondrial issue, we can usually get away with lower doses. But if it's more of a like chronic infection, for example, we may need to get to 25, 50 milligrams of methylene blue, maybe twice daily. And to do that, you go slowly so that you see the mitochondrial benefits early, and then you go up to the higher doses and you start seeing the anti-infective capacity of it. And so, like all my patients have the higher strength methylene blue in their medicine cabinet in case they need it. And what does that mean? If they have an acute infection, if they have like acute low oxygen state, so God forbid, like a stroke or traumatic brain injury or a severe injury, there is good data, at least in animals, that methylene blue can rescue mitochondrial function and improve outcomes in animals if you give it early. And so it doesn't make it so that you don't go to the hospital or you don't get treated for whatever's going on, of course, but it can be an additional support to that whole process overall. And so, but that's only for your acute things. Like and so a good example of this is my mom. Okay. So my mom she got bitten by a tick. She lives in New York. And so she had a significant inflammatory response on her leg and she had never tried methylene blue before. Okay. And I was like, you need to take 150 milligrams of methylene blue right now. And she's like, it's 5:00 in the afternoon. You've told me about methylene blue. It can make you more awake and active and things. I'm like, it's not going to matter. You're going to sleep great. And so she took 150 milligrams of methylene blue. She slept great, had no problem sleeping. But if I had taken 150 milligrams of methylene blue at 5:00 tonight, and I don't have like an inflammatory response going on, I'm not going to feel very good. So, and I know this from my own personal experience, which you asked me, is that, and so for me, if you have an acute issue, you can tolerate much higher doses of it, what it comes down to. If you have more of a chronic issue, or you're like especially if it's mitochondrial, you want to start off at low doses. And then if it's a chronic infection, then maybe, you want to be titrating your doses to higher amounts. That's gonna be more anti-infective overall.
Okay, coming back to you. What's the most you've taken at once?
The most I've taken it once is when I had COVID. I took 150 milligrams and I tolerated it like a champ, no problems at all. A friend of mine, a colleague that works in the company, he took a gram, like 1 full gram of methylene blue. And I've had a couple people report to me that they've taken that much and they felt fine. But I don't recommend taking that kind of dosing very often, right? Because when you get to really high doses of methylene blue, instead of it becoming more of a redox cycler where it enhances energy production and detoxification, instead of that, it actually becomes a stress on the system and can cause more issues. Some of the issues that it actually reverses, like hemoglobinemia, it actually can cause it at those higher doses.
And you've been clear that it depends on health status, if there's an infection, how it'll react in the body. But in a general sense, somebody who isn't sick, and again, coming back to the way I described the energy, the focus, how much of a dosage can you keep increasing and keep seeing that go up typically? When would you hit a peak with the mental benefit that I was talking about there? If you're feeling good for like an interview like this or performing on stage.
Yeah, I find that people find their sort of max level somewhere between 16 to 25 milligrams is usually the most people will need. After that, they start feeling a little jittery, like a little bit more funky, like it doesn't feel as good. But some people, it's even lower than that. Some people, it's 8 milligrams and they feel crappier when they go to 12 and a half or 16. So the range is anywhere between 8 to 25 milligrams, I found.
Okay, we're running out of time here. A couple more things I want to make sure we hit on. The light interaction with methylene blue. And this is something, if you Google methylene blue, it'll be one of the first things that come up. The fact that when there's certain light hitting the skin, it'll actually enhance the way the methylene blue works. So talk about the physiology there.
Yeah.
And then basically what I want to make sure we parse out is that exponential boost we get from doing that basically the same as taking more of it, or is there something different that happens?
It's a good question. It would be hard to, it's kind of like an apples and oranges kind of thing, I think, a little bit there. But when it comes down to the synergy, methylene blue can donate electrons to part of your electron transport chain called complex 4. And that's the final protein that's responsible for the flow of electrons through. And then after electrons go through complex 4, they go down into the inner mitochondrial membrane, and they get neutralized by oxygen. That's why we need oxygen. That's why oxygen's the final electron acceptor. Near infrared light, which we spoke about earlier, about 680 nanometers or so, that light spectrum has been shown to donate electrons, not electrons, photonic energy, photonic light wavelength energy to complex 4 as well, to help with the flow of electrons through it as well. So they're synergistic in the sense that they both are allowing improved electron flow through complex 4, and likely also regenerating and optimizing that particular complex called cytochrome oxidase as well. So that's why when you take your methylene blue and then 30 to 45 minutes later go outside and get some sunlight or go in front of your near infrared light panels, you will feel this boost. You will feel this energetic boost. It's like a lift. It's not subtle if you get to the right dose of both of these. And it's like it's a really great combination. You feel more energy, you feel more focus, you feel lifted, etc. When it comes to, does it feel like you are on a higher dose of methylene blue by combining them? That's hard to know. Like, everybody's gonna be a little bit different there. I think that it's an apples to oranges comparison. I would say that it's a bit different. Personally, for me, taking a higher dose of methylene blue feels, it's less like I want to go outside and do something really, like, I think there's more of like an energetic shift with the light than there is with increasing the methylene blue on its own. Like, there's more like I can't sit still, like I want to go do something kind of feel with the light compared with the methylene blue compared to just an increased amount of methylene blue on its own. So it's almost like there's almost more of like a surge of there. It's almost like a heat kind of thing. And I think part of that is the heat response of the light itself, even though it's not a huge amount of heat. Like, an example here is that I almost gave myself heat stroke when I combined methylene blue with 110-degree heat outside. I didn't realize I've done 110-degree heat before and been fine, and I was well hydrated, but I was making so much energy combining these two things together that I was putting off so much more heat that I almost gave myself heat stroke, and I had to cover myself in ice. It was an entertaining sight. But so that's something that I kind of found that may be slightly different in comparing the two.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The challenge is that if you have mitochondrial dysfunction, you have issues with fertility, you have brain fog, concentration issues, you have cardiac issues, liver detox issues, exercise-induced fatigue, all these things. And so working on mitochondrial function is so, so important. Insulin resistance